This is Average Joe PT, where I bring you content to help improve your life on a daily basis. I'm a physical therapist and I've been around for quite a few number of years. I don't want to give it away, but if you see my intro to the actual channel, it gives you a pretty good idea how long I've been doing this. Anyways, so I'm bringing you content all about physical therapy, fitness, education, and a little bit of humor that you can do inside your home to hopefully make yourself feel a little bit better and get rid of the pain a little bit. So today's discussion is going to be about the spine and what's a herniation, what's a bulge, what's a rupture, what's a fragmentation, all these different terms that can be thrown out, or as people will say, slip disc, degenerated disc. I have DDD, degenerated disc disease. So today we're going to talk about what do these things mean, how scared should I be, what can I do in my own home to help reduce my symptoms and hopefully reduce the consequence of ever having this happen to you again. So that's what we're going to talk about today. So stay tuned. Here we go. All right, folks, so let's talk a little bit about anatomy for a second. I don't want to bore you to death, but I at least want to get us all on the same page so we can at least figure out what's going on. So let me take down Mr. Handy Dandy Spine here for a second, kind of give us a better view of what's really going on. All right, and so we're just going to look at the lower back here. So for instance, so we got our hips, or some people will call your pelvis. All right, and so if we look at the back side of someone, now someone who's really skinny, you can see these little protrusions out the back. Now these are called your spinous processes. Okay, don't really need to know all that, but at least it kind of gives us a frame of reference of what we're talking about. And so if we turn you to the side, or turn Mr. Spiny here to the side, he's got these little green things. Now these green things are representing the nerves that come off of the spinal cord. All right, and so what's the spinal cord? Obviously it makes us move, makes us do everything. It sends all the signals to all parts of our body, including our organs. All right, but in the lower back, the actual spinal cord usually ends about L1, L2. It depends on the human, but really it stops right about there. Okay, and so from that point on, you're not really dealing with a spinal cord, you're dealing with what we call the peripheral nerves. Or in this case, when it goes past L1, L2 where the cord ends, it's called the equina area. And so that just basically is a fancy term for horse's tail. So apparently when they figured this stuff out a long time ago, long before I existed, it looked like a horse's tail, and so that's what they called it, but it sure sounds funny in another language. But anyways, so let's go ahead and just talk about the disc. Now, I talked about last time on just chronic back pains what the discs really are. They're just kind of like these cushy things, all right? And they separate the body, or what we call the vertebral body, or just the spine itself, all right? And they basically are absorption. They keep things from getting pinched in the nerves or on the back. So last time I also talked about these little things on the side, these little ear things, and these are called your facet joints, all right, or Z joints or zygapophyseal joints. So that kind of gives you an idea, at least from last session. If you looked at that actual video, you can go ahead and look back at my channel. I've only made a half a dozen so far, but more to come when it comes to giving you decent content, education, a little bit of fun, and hopefully getting your symptoms to calm down. But back to the story here. So when someone comes in and says they have back pain, there's a lot of places you can get it. First thing the doctor would like to do sometimes, if they can, if you would like to, is they'll do an x-ray. And that x-ray is just going to clear you of any type of fracture. Or the scary part, it could show signs of cancer. So it'll also, maybe the height of the bones, it'll show them if they're less or if they're more. Kind of gives you an idea there. But that's really all. It's not going to show you any soft tissue, no ligament damage, no tendons, no disc being quote unquote blown out or whatever. So the first thing we talk about that I said in the very beginning is what is a herniation? So an HNP, or herniated nucleus pulposus. Basically, if you look at the disc is basically, if you looked at it, a live disc, it looks like wet seaweed. That's kind of the consistency of a disc. Now, when the disc gets degenerated as we age, which is normal, it's a normal response. Degenerative disc should have never been called a disease. When it was named a long time ago, now it scares everybody to death when you hear the word disease. It's a normal process. People can have symptoms with it, or they might not have any symptoms with it. But rest assured, if you have degenerative disc disease, which a lot of people have, including myself, all right, it's not a death sentence. All right, it's a natural response, and if you do the smart things and you watch my channel and you listen to me, all right, and when you do have some back symptoms because maybe that's gotten flared up, I hopefully can help you a little bit. All right, and so if we go back and look at the actual disc itself, now talked about as you age, it kind of flattens out and thins out, and so that can put a lot of stress on the joints on the back, as I said. Now the other thing is if you have a bulge, sometimes we'll say I have a disc bulge. Now a bulge is essentially that, if you think of I'm going to give you a donut, but it's really not the donut. But if you look at the actual nerves, there are no nerves within the disc space itself. All right, so when you have a bulge, all right, you could have had that bulge for years. All right, it isn't until it starts to get things inflamed or swollen, like the nerve or the joints in the back, or the muscles start to get locked up in spasm, is when you actually start to have symptoms. So when you go and you get an MRI, all right, when the doctor is trying to figure out really what's going on and you haven't gotten better with what we call conservative therapy services or treatment, whether it be acupuncture or physical therapy or a fitness trainer or a chiropractor, all right, they're going to try and get an MRI and see what's going on. Why the heck is this person getting any better? And so that MRI can do a couple things, okay? It's the magnetic resonance image is what it stands for. Essentially, it's going to show all the soft tissue. Unfortunately, it can show what we call in the business a false positive. And what the heck is a false positive? A false positive is where the MRI kind of shows things going on, but it's not really where your symptoms are coming from. You might have multiple disc bulges and some degenerated discs and stuff like that, and that might not be where your symptoms are coming from. So be mindful of that when you get these MRIs and you think the doctor is playing you off. In reality, the doctor knows that there's things called false positive in these images, and it can kind of give you an idea of, there could be something going on, or there's not. It gives us an idea where to go with your treatment. So just be mindful. If the doctor doesn't give you an MRI right off the bat, it isn't because they don't know what you're doing. Trust me, they've gone to a lot of schooling. I've gone 7.5 years myself as a clinical doctor in physical therapy. They've gone twice as long as me, all right? And so they know what they're doing. They just need to go through the steps and make sure that they're treating you and not missing any possibilities, or I call in the average Joe is falling between the cracks. All right, so that's a herniated disc. All right, a bulge. A herniated disc is where actually the disc itself is started to protrude out on the nerve. I don't know if you can see that. I'm going to show you this kind of, so I can get up here real close for you. But you see that little nerve coming out? All right, we also talked about stenosis too in one of my sessions. And so these nerves that come out through, that stenosis is where the arthritis kind of gets in there, makes that canal smaller, and so the nerve can get pinched very easy. But I digress. So that nerve can get irritated if that disc starts to push out on it. All right, and that's not good. That can get things inflamed and cause all these chemicals, what we call histamine responses, to occur and give you some symptoms. That's why sometimes the doctors will give you some steroids initially to try and get those nerves to calm down, the inflammation to calm down, and maybe make your symptoms go away. All right, and then your body kind of pulls that disc back in. All right, and then it kind of scars itself up if you do the right things, as I show you on my channel, which is I'm always talking about not being a letter C. All right, when you're a letter C, look at how much stress you're putting on everything. You can't be like that all the time and think that you're not irritating the joints, the tendons, and the muscles. You're over elongating all that tissue constantly, and your body weight's going down through. All right, it's not a good thing to have. This thing's inflamed. Who wants to be inflamed? I don't want to be inflamed. Mr. spine here doesn't want to be inflamed, and I'm sure you don't want to be inflamed too, okay? And so we talked about the bulge, we talked about the herniation. Now the scary one comes. I call it fragmentation. It's literally where the disc piece breaks off, usually because of a trauma. It's not just because you're just getting old and things get inflamed, and that's not a chronic nature. Usually it's trauma based. And so a piece of the disc breaks off and kind of can bounce around and float in there. And so that's obvious that you're probably going to have surgery. Your body's not going to reabsorb that fragmentation like your body can absorb a couple other things. It's going to do more harm than good if it stays in there. And that's usually a red flag. The doctor is going to send you to either an orthopedic surgeon or a neurosurgeon. Both of them can do the same type of surgeries. Now that could be a whole other discussion. That's where things can get confusing, where, do I go to an orthopedic surgeon for my problem? Do I go to a neurosurgeon for my problem? So we can have a later discussion on that to kind of give you at least some fillers and grades, see which route that you would want to go. But okay, so that's the bulge, that's the herniation, okay. And then obviously sequester or fragmentation, where it's just kind of popping out in there. All right, so that kind of gives you an idea of what the idea of what's going on when it comes to a bulge, a herniation, or fragmentation, or rupture. Okay. And so I'm going to go over with you just some basic exercises. All right, one of them is Robin McKenzie. God rest her soul, they passed away, but they passed on the information to us, and I'm going to go over that a little bit to you, or at least go over the basic exercises, when it's appropriate, when it's not appropriate, when it's a red flag and you shouldn't be doing it all. You should be going to the doctor immediately, okay? And kind of give you an idea of why do I get in this position and I feel better? I know I feel better. Why am I in that position? So stay tuned. I'm going to show you some of that stuff in just a moment. So go ahead and stay there. Maybe grab some popcorn, pause a little bit, and then you can come back and watch really what's going to help you the most. But at least you got some decent information. All right. So hold on a second. I'll be right back. All right, folks. So these are the exercises I'm going to have you do for a disc bulge or herniation. Now, if you're having a rupture, like I said, these exercises aren't appropriate for you. You need to go see a doctor. And how would you know if you had a rupture? You're not going to know a fragmentation. You're not going to know until you go see the doctor, and hopefully they do an MRI. But some of the symptoms you might have are constant leg symptoms, neuropathic numbness, all right? Big sign. All right. Another one might be that your ankle's very weak. It doesn't feel like you can keep your leg up, or your leg is buckling. All right. A bowel or bladder issue where for some crazy reason, you're not able to hold your bowel or bladder. That's immediate emergency room. This is not appropriate for you at all. This is appropriate for someone that has maybe some pain down in the thigh or something like that, and it seems to come and go. All right. And also, if, like I said before, if this doesn't seem to get better in a week or so, you need to go to the doctor. Don't be trying to continue to do my exercises if your symptoms don't seem to be improving. Your symptoms should be improving with these exercises within a few days, all right? So exercise number one is just as simple as this. You're just gonna lie down on your stomach, nice and rested. You're gonna let your back relax. Your back muscles need to relax. Now you might have to lie here, all right, for a good 5 minutes before your symptoms really start to go away in your back. How you know this is appropriate? You start to feel that your leg symptoms are getting better, all right? They're not as bad. It seems to be traveling back up towards your thigh and maybe in your lower back. That's a positive sign. If it seems like you can't tolerate this position, I want you to take a pillow, all right, and put it down at your belly button. Like I told you for your chronic symptoms last time, this will help straighten your back out a little bit and then come back into this position. You might be able to tolerate it better like this. And maybe put some ice on your lower back for maybe 10 or 15 minutes. Ice, ice, ice. Do not heat if you're having any type of nerve symptoms. All you're going to do is speed up the nerve and irritate it more. All right? Now you want to do this until your symptoms go away. Now you might be here 15 minutes, 20 minutes, and I want you to do this several times a day. All right, stay away from that sitting. This is going to help break up that sitting position. The next phase you want to do, all right, let's come up on your elbows. Come up on your elbows, maybe hold there for 10 seconds, 30 seconds, and then come down, relax. This might give you pressure in your lower back, that's normal. It should not give you any pain in your butt or down your legs or crazy numbness. If it does, stop doing these and you need to follow up with your doctor. All right. The third and final one, maybe if this is really starting to improve after about a week, your leg symptoms are much better. You're going to do maybe a press up. Keep your belly button nice and flat on the surface and then come down and relax. You're going to try like 10 or 15 of those. You should have pressure in your lower back, but nothing down your legs. Okay? So, to finish up, ice, ice, ice. Obviously, make sure you don't burn yourself. Start out with the basic exercise. If it seems to be helping, continue to do that. If it doesn't seem to be helping, you need to follow up with your doctor immediately. All right? So that's the basic Robin McKenzie exercise. Now, they have a progression to this. I wouldn't want to do that unless you go and you see a professional, but that will give you an idea of what they might do to help reduce your symptoms in your leg if they're neuropathic in nature. So let's go ahead. We're going to wrap up and finalize this episode. And if you have any questions, leave a comment down below. Hit the subscribe button. Hit the bell. I'm going to be doing these 3, 4, 5 times a week. All types of information that can help you reduce your pain in your lower back, in your knees, in your shoulders, in your neck. This is basically free information, all right? It's not the only information. Make sure you're following up with a professional. This is extra information for you, so that way you don't have to log through the internet and try and dive and find out the information yourself. You can come to my channel, Average Joe PT. All right, so let's go ahead and finish up. All right, folks, so I just got done explaining to you about the different exercises that you can do for at least a short period of time to see if it starts to reduce those symptoms that you're having from a bulge or a herniation. All right, and now, like I talked to you before, you don't want to do this type of exercise if you're having, symptoms that seem to not reduce. What I mean by that, you don't seem to decrease, your symptoms don't seem to improve. All right, that's a clear sign that these aren't appropriate for you. You need to follow up with your doctor immediately. All right, so as always, don't forget, put some comments. All right, I think next time I might talk a little bit about either the foot. All right, I haven't talked about the foot at all. Talked about the elbow or anything else. So right now I've kind of hit a lot just on the spine and the shoulder blade and the knee a little bit. I guess I can talk to you about osteoarthritis of the knee or some sort of tendonitis of the knee. I think a lot of people get that and would like to have an idea what they can do. So maybe I'll talk about the knee next time, maybe like a runner's knee or just some chronic knee pain. All right, and so stay tuned. I want you to keep looking for some updates. All right, hit the subscribe button and hit the bell so you know that the content's coming. Like I said, it's going to be coming 4 or 5 times a week. And like always, look up and keep smiling.